Hey everyone, thanks for joining us again. And we are here with Dr. Boccalandro with Medical Center Health System. It's been a while since I've seen you.
Good morning, Jolene. Thank you for the opportunity.
Yeah, and so glad you're here. So today we're going to talk about a specific device that helps people who have AFib. But before we get to everything, can you please explain what AFib is for anyone who doesn't know?
Sure. So atrial fibrillation, Jolene, is a very common rhythm. We have about 200,000 patients yearly that get diagnosed with atrial fibrillation. So it's very, very common. It's about 5 million patients in the US with atrial fibrillation, so it's something that cardiologists we see every day, and patients too. It's basically a very irregular rhythm. It comes from the upper chamber of your heart. I don't know if you remember from science classes, we have the upper and the lower chambers of the heart, and they both work in synchrony to be able to make the heart a very efficient pump. So this rhythm is very fast, it's very irregular. It comes from the upper chamber of the heart. So you lose the synchrony between upper and lower chambers, and when that happens, when you're going very, very fast, the upper chambers of the heart truly don't contract very well, and then if you have blood that pulls in the heart, you can form a blood clot. So that's what atrial fibrillation is. And
so just to give you guys a visual, we actually have a video that we can pop up here in a second. We're going to show what a regular heartbeat looks like, if we can get that video. So this is what a regular heartbeat would look like. And then if we get to the next video for someone with AFib, it's very irregular. So something like this, right?
Yes, exactly. It's very irregular, very fast most of the time.
And so ultimately, when these, exactly how are the blood clots formed then? And I guess for people, how can they be prevented?
Right. So that's a great question, right? Because atrial fibrillation by itself, right, it probably won't kill anyone except for the ability of this rhythm to form blood clots. So it's important to understand how do we form the blood clot there, right? So the left upper chamber of the heart has a little pouch which works like a reservoir for that chamber. Like when you have extra volume, like you drink a lot of fluid, then you expand that pouch, and that pouch is specifically, Jolene, where it's called the left atrial appendage, kind of a long name. So that left atrial appendage, once you go to atrial fibrillation, right, doesn't truly contract, just stay in place. So blood can sit in it, and that's where you can form a blood clot in that little pouch called the left atrial appendage.
So obviously we can't just look into our bodies and see that we have it. So what are the signs and symptoms? Like how would someone know that they have AFib?
AFib, yeah. So it's interesting, AFib now, it's in the forefront, right? Because a lot of people now have wearables like your, smartwatch, and now there are devices that you can see your EKG, and and you can get it anywhere. So people are very aware now what their rhythm is. So the awareness of atrial fibrillation is significantly more now than it had been before. But so 30% of patients may have no symptoms, right? They may be in atrial fibrillation about their day, they don't know they have it. But then the rest of the patients, they can have symptoms. The heart, as we said, goes very fast and irregular when you're in atrial fibrillation, so you can feel the heart going fast. Some people can experience some dizziness when that occurs. They can have definitely shortness of breath when they try to, do any kind of physical work, right? So people tend to be symptomatic. If you have it for a long time untreated and the heart is going fast all the time, then you also can have weakening of the lower chamber of the heart, so you can start having heart failure. So it's something that not only the clots can be a problem, but the rhythm itself can be problematic as well.
And so for your patients who have AFib, what is the age range typically that you would see?
Yeah, so that's a great question. So, atrial fibrillation usually start to present in midlife and start to be more and more often as we get older. So it tends to be a disease that we collect with the years. Part of it because as we get older, some other things happen in the heart. The heart also ages with you. So you have some structural changes that condition to atrial fibrillation. So most of the people tend to be 50 and above. We still see that in young people sometimes, but not as common as we see in adults. Yeah.
And how common is it here in West Texas?
It's very common. It's very common. Like I tell you, there's not a day I won't think that I will see a day free of atrial fibrillation will be rare, right?
Wow.
It's very, very common. So we have about 200,000 patients, new, patients a year in the U.S. So it's a very, very prevalent. Also, part of it is because we're living longer, right?
Mm-hmm. Mm-hmm.
Also, it's linked to other risk factors like overweight and obesity, alcohol intake, right? So there are things that can increase the frequency of atrial fibrillation.
Interesting. Okay. And then does AFib go away on its own, or does it need treatment?
Yeah. So that's a good question. If you have, right, sometimes you have some acute problem, and we saw that a lot, for example, during the COVID pandemic, right, that people have an acute viral infection. Then in those patients, sometimes just come for a very short period of time and goes after this acute, storm has passed.
Right.
But by and large, atrial fibrillation tend to be a progressive disease. And then you start to see people that have it on and off for a short period of time at the beginning, which we call paroxysmal atrial fibrillation. But as time passes, right, then you can see that they start to have more frequent episode of atrial fibrillation and more prolonged episode of atrial fibrillation, right? So tend to become a chronic disease.
Wow. So one of the things that I thought was really interesting that you told me is that Medical Center Hospital is using something, it's a long name, so I just call it the Watchman device. We have a picture of the Watchman device
Sure.
if we can pull it up. So it's not that it's like brand new, but you guys, here it is. So you guys have been using it for a while. What exactly is this?
Right. So this is a very ingenious concept, right? Mm-hmm. Normally, as we discussed, right, the mechanism that people have blood clots is in that little pouch called the left atrial appendage. So when that left atrial appendage doesn't really move much, then you have the tendency to form blood clots when you're in atrial fibrillation. So the standard treatment for the majority of our patients is to put it in blood thinners, right? And aspirin, which is what we think when we think about blood thinners, unfortunately not effective for these. So we require stronger blood thinners that prevent the formation of blood clots in that little pouch. But, right, there's a lot of patients that run into a lifetime risk of bleeding, right? Like, because you have to take this, as we said, this is a chronic disease, so the expectation is you're going to be taking it for a long time. But over the years, right, some people are unable to take the blood thinners because they may have bleeding complications, right? So then, physicians and engineers start to think, well, if the problem is in that little pouch, can we plug it in, right? Can we put a plug in it? Right? Can we just seal it out, like if you have a little pocket, right, and you put a little plug in it, right? So basically that's the whole concept, right? Can we deploy a plug safely in our patients and effectively? So that's what these devices do. They basically close the left atrial appendage, so you don't have that pocket anymore, and therefore you could not form blood clots any longer.
So let's pull up this video because what Dr. Boccalandro was explaining. So this is the pocket that you see right here on the right, right?
That's right.
Okay, that's very interesting.
And that's the blood clot, you know?
And so ultimately, that's something that you want to prevent.
Correct.
So, okay. And so my question is, how come Medical Center Hospital is the only institute that's using this?
Yeah, it's not the only that's using it. In the area, it is the only that's
right.
using it.
Yeah.
And the reason is because this is part of a bigger program. Mm-hmm. It's called a structural heart disease. And it requires a set of skills to be able to use these devices that we're the only center that currently have the skill set to do it. It requires not only training in cardiology or interventional cardiology, but also in another subspecialty of interventional cardiology called structural heart disease. So we have 3 physicians in our institution that are trained on these devices. And also requires institutional support. We have been very fortunate to work in an institution that's very forward thinking, so have able to support us to develop the program, and require also a structure in terms of technicians that help us to do these procedures. We work very collaborative with our partner from anesthesia to help us as well. We have sonographers, we have navigators, right? So it takes a village to be able to have one of these programs successfully implemented. So we have been leading, cardiovascular care in the area, and we decided to start doing these procedures approximately 2 to 3 years ago, and we already have implanted more than 100 of these devices locally, with no complications. So I think also it's part of what interests you have, right? But I think it's a great service for our community.
Yeah, for sure. And it's not too invasive. I mean, it's like a small incision that's being made. So you have a team that's skilled in knowing how to do that. Yes,
exactly. So the beauty of it, you're absolutely right. The beauty of it is like, it's a very small puncture. We make a small puncture usually in the inguinal area. And that's really all it is. I mean, it's not, we don't have to open the heart to deploy the devices, or, the recovery is very, very fast. Patients can go home either the same day or the next day. So, it's very, the downtime is very, very small.
Wow. And it only takes like, what, 30 minutes?
Yeah, the procedure, majority of the procedures, right, it can take of my time probably 30, 40 minutes to do that, For the patient itself, it may take a little bit longer, right?
Oh, here it is. Here's the little incision that's being made.
There we go.
Wow. So yeah, so you can see for yourself, it is scary to think about putting an implant in, but when you actually see it, it's so small. Wow. So, and then you were saying, I guess it depends on the patient, right? But do people need to take blood thinners after this procedure?
Right. That's a good point too, right? Because our goal, Jolene, is to take them off the blood thinners, right?
Right. Yeah.
But that device has a metallic structure with a fabric. So that fabric, in the first 45 days until that's kind of covered by your own tissue, may have a little bit of risk to form a clot in the fabric of the device. Our preference is to use blood thinner for 40 extra days after the device, although we have a new generation device that we can completely stop the strong blood thinners right away. But our preference is to continue the blood thinners, if all preferably for the first 45 days. After that, usually we do an ultrasound to make sure the device is in a good position and we're happy the way it looks. And after that, pretty much, right, it's going to be aspirin and much softer blood thinners than we use for atrial fibrillation.
I just think it's so interesting that it has the fabric on there that kind of just like molds.
Yeah, the device it's just so marvelous of engineering, right?
Absolutely.
Has this kind of metallic structure that is kind of pliable and accommodates to your heart, and then you have that cloth kind of to seal that pouch. So it's a very, very ingenious technology.
And so down the road, long term, what would it look like for a patient? Would they have to come back, and do they ever have to take the implant out or no?
Right. So we never take it out. Okay. The road for the patient, it's very easy after the implant. We only have to do, as I said, an ultrasound about 45 days. After that, it's pretty much just take very what we call antiplatelet therapy. So we take aspirin and an additional antiplatelet therapy, which are much softer blood thinners for the first 6 months.
Okay.
And after 6 months, it's just an aspirin a day for the rest of your life. So it's much simpler regimen for the patient in terms of medication, less costly, also with less risk than they have to take a lifetime of blood thinners.
Right,
yeah.
And that's what I was going to ask. I mean, does this come with any like long-term risks?
So it really doesn't, at least that we understand as today. Of course, there's always risk when we manipulate the heart to put the implant. Risk, that's our job. Make sure that we, carry out you safely through this journey.
Right, exactly.
But after the implant, really the risk so far it's minimal. Yeah.
Do you wish more people in our community knew that this exists? Because it's not new. You guys have been using it for 2 years already.
Right. Yeah, I think it's important, right, for patients to be aware we have this technology. It's important also to understand that this is not for everybody, right? We have, our preference is still, I think, is to, take medications rather than procedures. So, I mean, if you can take your blood thinners responsibly and safely, that's a great option, right? But for a patient that cannot take them, I think with this technology, not to be protected from strokes is not really a great option, right? Because if you have difficulty with the blood thinners, this can really protect you from a stroke and could could free you from the blood thinners in the same token. So it's a very good option in the sense that decrease your risk of bleeding, but also decrease your risk of a stroke, right? Blood thinners decrease your risk of a stroke in the same way, but they in a way increase your risk of bleeding a little bit, right?
Yeah.
So I think everybody needs to be aware. This is something that not only we do here, it's done in many places nationwide. And if you have difficulty with the blood thinners, potentially it could be a good option. Not, as I said, when I said also it's not for everybody, is because also this device have some limitations in terms of your own anatomy, right? Is this pouch is very big or it's very shallow, right?
Yeah.
Then we have different implant size that we're trying to adjust to your anatomy. But there are some anatomy that are very challenging for this device to attach well. But the majority of the patients, I will say, it works very well. Yeah.
Right. Well, if someone's watching right now and they're interested in getting a hold of you guys, how can they look into the first step when it comes to the Watchman device?
Yeah. So they can call us in the office and we can give them information. There's also online information. For people who are certified to implant these devices as well, not only here but nationwide. So if they need somebody or they're interested to talk to somebody who knows about how to do this, they also can look in the website, for the device itself, and there's where physicians who are trained to implant these devices are. So I think that gaining that information is powerful for the patient in case they have questions.
Is it a fairly easy screening process if a patient's interested?
Yes, it is. I mean, the same way that we do an ultrasound, when we finish the implant, we usually do an ultrasound before the implant, and that's really how we screen these patients. We also can do it with CAT scan, which is, CAT scan gives us a very good view also of that part of the heart. And then once we screen the patient and we look at the anatomy, we can say, hey, Jolina, this is good for you, or or it really don't fit on your anatomy. And that's, I think, the main thing that we look. And we look also at the whole patient as a whole. I mean, what is the age of the patient, respiratory status, right? All our comorbidities that will make sure that the procedure is safe for the individual patient. Yeah.
The future is now, Dr. Boccalandro. So cool and just so great to learn about that. So Dr. Boccalandro with a Medical Center Health System, thank you so much for being here. And what kind of advice, and this is just for, even with people who don't have AFib, what is the best advice you could give to someone for living an active, healthy lifestyle and have a healthy heart?
This is relevant even for atrial fibrillation because, right, when I tell you as we get older we have more atrial fibrillation, part of it is because we develop cardiovascular diseases, right, as we get older. But the big bulk of cardiovascular diseases, Jolene, are preventable, right? So what can we do, right, to prevent in general, cardiovascular diseases, and that actually may help you to prevent atrial fibrillation, right? So the American Heart Association have a number of core measures that we want everybody to be aware, so everybody can follow, so we don't have to see cardiologists, right? And that is to keep a healthy weight, right? Keep a heart healthy diet. Make sure you know your glucose, because diabetes is escalating, so make sure if you have diabetes, get treated. Make sure your cholesterol is controlled. Physical activity, no tobacco products of any kind or tobacco exposure, and the new kid in the block, sleep. The American Heart Association also have recognized that poor sleepers have poor cardiovascular health, so we also, it's recommended to have 7 to 9 hours of good sleep a day.
I'll keep that in mind.
No, yes, it's very important. It's very important. So those things really can go a long way, right? If everybody will, yearly, right, check those boxes and make sure that, we have all those things plus the blood pressure, right, in good targets, I think that we will have a much better life for a lot of our patients and our community.
Yes, and it's just small little lifestyle changes that you can do to live a happy and healthy lifestyle. All right, Dr. Boccalandro, thank you so much again for joining us.
You're welcome, Julie.
We're going to be posting everything on our website at newswest9.com if you want to inquire more about the Watchman device. But once again, Dr. Boccalandro, thank you so much. We'll see you guys next time.
You're welcome, Julie. Thank you for the opportunity.